Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Find out what's missing in your hormone testing with Dr. Carrie Jones from Precision Analytical, the creators of the Dutch test, a dried urine test for comprehensive hormones. Dutch test results give you all the information from the other methods combined and has easy collection. Visit dutchtest.com for more information. Today our guest is Dr. Carrie Jones, who's a naturopathic doctor whose passion and expertise lies in the area of hormone, adrenal and thyroid health. She recognises that imbalance can occur at any age and believes that it's important to look at the big picture, such as the use of appropriate lab testing. Thank you for joining us today, Carrie.
Thank you for having me. I'm really excited to be here.
Can we find out who Dr. Carrie Jones is? Have you always wanted to be a doctor?
Yes, actually, since I was a very little kid, I knew I wanted to be a doctor. Now, I thought at the time that I wanted to deliver babies, actually. And when I went into medical school, I knew I wanted to do women's health. I thought obstetrics is where I wanted to go until I got to experience it. And I thought, no, this isn't for me. I don't think I want to give up my life to delivering babies. And kudos to those midwives and doctors who do. But I did keep on the women's health course of study. And that's basically all I trained in, women's health and hormones. So when people ask me what I do for a living, I tell them that I help hormonally crazy women be less hormonal. That's what I do.
I don't have trouble with hormones. Yes, I'm glad you got that. Okay, so what experience have you gathered along the way to date?
So I went to medical school in Portland, Oregon. There's the oldest naturopathic medical school in the United States. It's the National University of Natural Medicine. So I went there, and then I did a 2-year residency in women's health and hormones. And like I said, that's just the direction that I knew I wanted to be in. And when I got out of practice, I had 2 different big clinics. I was the medical director of one clinic for a while, and then I moved into a different clinic that was much more integrative, and it was wonderful because it was owned by an MD, but she also had nurse practitioners and physician's assistants, and there were a few of us naturopathic physicians there, and so it was a really wonderful experience to be their medical director and really truly integrate, traditional medicine with Western medicine, and get the best of both worlds. And so that's kind of my path, and it's kind of the, what it took to where I am now. Now I work for a lab. I'm the medical director for Precision Analytical. And once again, I do all hormones. Mm-hmm. Hormones is still what I do. I just do it a little differently. Instead of treating patients and clients, I help other clinicians and practitioners who are trying to help their patients and clients get better. So I do a lot more consulting nowadays, but still in the same field. And people will still always ask me, like, oh, do you treat men? Yes, I do treat men. I joke, but it's women who go to the doctor, right? Men go to the doctor only because their wives or their mothers or their sisters, get on their case and say, go to the doctor, you're a mess. So, but usually it's women. Women unfortunately get a lot of the hormone fallout.
Okay.
So that's how I got here today. Yeah, this long hormonal path.
So how far down the line was it when you first heard about LDN?
Let's see, I heard about, I would say maybe 6+ years ago when I heard of LDN. There was the compounding pharmacies in Portland, Oregon are wonderful. They're very educational. And I had this compounding pharmacist that I work with all the time. We're on a first-name basis. And she said, have you heard of Low Dose Naltrexone? And I said, nope. I mean, I knew what naltrexone was, but I didn't know what Low Dose Naltrexone was. And she said, well, it's this thing. Let me educate you and let's talk about it, especially as I saw a lot of autoimmune patients. I had a lot of Hashimoto's patients, chronic fatigue, fibromyalgia, which is not technically autoimmune, but just sort of that the immune system was just sort of off. These patients had a lot of symptoms, and we were working with adrenals. We were working with thyroid, diet, gut health, their hormones, and they would get better, but they would not get much better. Or they're like, well, I feel good, but I feel like I could just go like an extra 20%. And so this pharmacist said, let's try low dose naltrexone. Let me explain it to you. And so I did a lot of research into it. But at the time, 6+ years ago, it was newer, or it just wasn't as much, it wasn't discussed quite nearly as much as it is now. I hear about it all the time now, which is wonderful. And so it was making a lot of headway and a lot of trial and error, unfortunately, with patients when we did dosing and symptom outcome. But I love it. I recommend it and prescribe it for patients often, all the time. Yeah.
So because you specialize in hormone, adrenal and thyroid health, I can see there that the type of people that you obviously are treating may be more on the thyroid scale. Have you found that any of those patients have reported any negative side effects? I know that many doctors have to monitor their patients carefully if they're on thyroid medication, because they may need to reduce the thyroid medication as they get started on LDN. I mean, is that something you've found to be true?
I have, yes. And the way I was taught for dosing, which I know everybody's a little bit different, was, start small, especially with thyroid, start with like a 1 milligram and move up from there. And so I would warn patients, especially if they were hypothyroid, hey, this is what it is. This is what LDN is. This is, what I'm hoping for. We're going to start small. And if you notice these symptoms, if you start to feel more hyperthyroid, we need to lower your dose. It means that the immune system, the autoimmune attack is reducing, is quite reduced, and you don't need as much of your thyroid hormone anymore. So I didn't see it very often, to be honest. I didn't have people who, I can't think of a single person where I was concerned. I would just run their blood work and I would say, guess what? You don't need to be on as much medication anymore. But to my recollection, I don't have anyone, thankfully, that had a complete bad side effect. I would say the biggest side effect, which is very well known, are the vivid dreams. And I would warn everybody, like, it could be a lot of fun. Or just be aware you might have these crazy vivid dreams, but over time they do tend to improve and, or fade away, I should say. And so if they can stick with it, let me know. I would say that's probably the number one side effect, which really isn't, in the grand scheme of side effects, that's nothing.
No. I honestly...
But when it comes to thyroid, yeah.
I had no side effects at all, no vivid dreams. And some people have explained these dreams and they've seemed amazing, and I feel a bit robbed, but never mind.
I know. And I've had plenty of patients who were excited for the dreams, and they came back and said, I didn't have a single dream. I was like, yeah, that can, okay. It just depends on the person. And others would say it was very, very like Cirque du Soleil. It was very wild and colorful and vivid and all over the place. And like, wow, that sounds fun.
So with pain, how long have you, in your experience, does it take for people to notice a reduction in pain?
I would say usually in the scale of pain, I would say quickly. Now, by quickly, I usually within a couple of weeks, people will start to notice it's like gradually improving. Their joint pain is improving, or even GI pain, ulcerative colitis, if they deal with daily stomach pain, they're like just gradually over time they notice, oh my gosh, this hurts so much less. Migraines, oh my gosh, I'm having my migraines are less frequent or they don't hurt as much. The autoimmune joint stuff, rheumatoid arthritis, definitely less flare. Their joint pain, their joint swelling, their redness gradually improves over time, and they're thrilled. And it's definitely, I find, of course, dose dependent. Some people, we start low and they only need low, and some people we go up to the standard 4.5 milligrams, and some people I have on 6 milligrams, but we just try it, and I let them know, it could take a couple weeks, and depending as we're titrating up, it might take them like a month or two, and they're thrilled because they've had this for a long time. As you know, like these patients are really suffering. When you live with pain every day, I mean, even just a 50% reduction is hallelujah, just to have some joint mobility back, or get the joint swelling down, or get the stomach pain to go away, or the head pain. It can be really amazing, really life-changing.
I've had some people tell me that they still have pain, but it's a pain that they can live with. They don't notice it, although it's there. They can still carry on with their life without it being a hindrance or stopping them. So that is a big deal, isn't it? And it was interesting you were saying about migraines. Before I started, I was having at least one migraine a week, sometimes two. And the day after, I used to feel absolutely rubbish. I used to get flashing lights, which are really pretty, all these pretty lights. And it would last for about half an hour. But you knew it was coming. I know. And after the half an hour, the headache would be boom, and it was so bad. It used to make me vomit. I used to have to be in a dark room and I couldn't move my head. I used to have a bowl with me. It was awful. But the crazy thing is, sometimes, when I'm organising conferences and things are getting a bit, not quite going quite right, I can get stressed. And I can trigger a migraine. I get the flashing lights. And the amazing thing is it still lasts a half an hour, get all these pretty lights where I can't focus, I can't see. And if I was driving, I'd just have to stop because I really can't focus. But after the half an hour now, you wouldn't believe it, where before it used to be a half an hour and then bam, this headache, I get nothing. It just goes. The flashing lights and it goes.
Amazing.
And that's happened for 13 years. So when I can't see, it's just like it's an inconvenience. Oh, I've got to stop for half an hour, just sit down, close my eyes. And then after half an hour, I can carry on. There is no thumping headache.
That's amazing.
No thumping headache. So I'm well pleased, just to trade it for half an hour. And it doesn't happen very often either. It's probably once every 3 or 4 months. Which, I mean, it's absolutely nothing. But not to get that pain is amazing. And I don't know how it works out. I don't know why that happens, but it definitely happens every single time. It's not even, every other time I get the headache. I just never get the headache anymore. So, yeah, that's good
amazing.
one.
See, that's a testimony right there.
It is, isn't it? Yeah, it's very good.
Yeah.
So people are always asking us, and I know how long is a piece of string, how long should I take LDN for if I feel it's not working?
That is a great question. So usually what I will do, and of course everybody's different, but I will, let's say, for example, I titrate them up and they're on 4.5 milligrams or maybe even 6 milligrams. So I have them stay on it for a solid month before we decide it's not working, that they don't notice any difference, no change in pain. And I score it ahead of time because, as we know, we forget. I mean, I don't remember things I did last week. And so if it's, let's say it's pain, like migraines is a great example. When they come in to see me, how often do you have migraines? Basically journal it. How often do you get them? When you get them, how bad is your pain on a scale of 0 to 10? Do you get the flashing lights? Do you get, sensitivity to smell? Do you vomit? Do you have the aura ahead of time? And so I do all that like in the very, very first visit. So that as we're working with LDN or any kind of intervention I'm doing, It's interesting how I will go back and I'll say, well, how many migraines are you getting now? And they'll say, oh, nothing has changed. I get them once a week. But I can look back and say, well, actually, when you were here 2-3 months ago, you said you were getting them 3 times a week. How bad is the pain now? Well, it's pretty bad. It's like a 6 out of 10. I'm like, well, when you came in, you said it was a 10 out of 10. It destroyed your life. So it's amazing what we forget, and especially if things are gradually getting better, it may be hard to notice, a complete flip. Now, however, on the other side, like I said, if they're like, well, it's still a 10 out of 10, and I'm still getting them 3 times a week, I'm like, okay. Unfortunately for you, LDN is not working. We've tried this, for several weeks now with no change, and that can happen. I do have patients who LDN just doesn't work for them. The endorphins just don't do the magic that I'm hoping that they'll do for whatever they're going through. So yeah, that's what I say.
And personally, exactly as you was saying, when you become sick, I have MS, and different parts of me were going numb. I knew that my left hand was going numb, and then it was up to my elbow and up to my shoulder and down my back. But when it started to recede, it was a case of the numbness slowly went, and I hadn't noticed. When did it happen? You can't remember. It's a big deal when you lose something, but as you get it back, you just shrug it off, I guess. It's normal now. and the brain forgets to tell you. But I was talking to a friend, and I'd been on LDN nearly 18 months, and she said to me, so, how are you doing? And I was saying to her that I'd stabilised a long time ago. But then I carried on talking about different things, and she was, well, actually, that's not what you said last time we spoke. And and just by sitting down and thinking hard and trying to track different symptoms with different things and times that I was doing them, because I didn't keep a diary either, I could see that I actually continued the benefits were still there, and I was getting better for like 18 months. It was quite amazing. It didn't all happen at once, but then it took me years to get as sick as I was. So you couldn't really expect everything to fall into place instantly, could you? It just doesn't happen like that.
And we get taught that in our naturopathic medical school. One of the sayings is, however long it took you to get sick, you could say, like, if it took you 10 years, over the last 10 years or 15 years, I've been really sick. I'm going to say, well, it's probably going to take you, at the very least, we put it to months, 10 or 15 months, to start really noticing a difference. You can't fix 15 years in a week. It's just not possible.
I think that
it takes time.
It gives people realistic targets and expectations, doesn't it? When they know it's not going to be
especially with. I agree with you completely, and especially when something is powerful is LDN. People maybe will take it for a weekend or a week, and then they say, "Well, I don't notice anything. This doesn't work." Mm-hmm. Well,
yes,
it does take. It definitely does. It takes time. You have to.
And I don't know.
Wait. You put some work into it.
I don't know whether you realise, but we actually now have an LDN health tracker app. And the information...
Oh, I didn't know that.
Yes, it's gathered anonymously, and it's all going into the world's largest LDN survey. And it does... You can set alarms, you can write diaries, there are pain scores, and sleep patterns. There's everything there that you can monitor, and you can then print out graphs and charts which you can take to your doctor. So, as you were saying about that patient, she'd be able to enter her daily pain and sleep and diet even, and supplements and all these different things and medications, and she would be able to see over time how the pain had reduced, how other medications had reduced, and have charts that she could actually see. So that is also encouraging along your journey. That's brilliant. That's fantastic. Yeah, I had it when you were saying that your example, talking to your friend. I have a patient with MS who was on LDN,
And she used to have to take naps every day. She was so tired. And at one point in a lot of our follow-ups, I said, "Are you still taking naps every day?" And she just looked at me with deer in the headlights, like, "What are you talking about?" I said, "Well, you used to take naps every day." And she had forgotten, one day she didn't need a nap anymore, and she just stopped taking naps, and it didn't dawn on her that was a change. And she said, "Oh my gosh, Dr. Carrie, I don't take naps anymore." So that's a big deal.
Exactly. And
this is great.
You do forget. So that health tracker app, I'll send you the details of that. It's very, very handy. And we have 2 researchers working with us, and we're going to have data published, which would be good. But as I say, it's all anonymous. People don't have to worry. And all data they put in is held securely, and it's case numbers like case number 1, 2, 3. No names are used.
Oh, yeah.
So that's
fantastic.
That's interesting.
Neat. Yeah, it's great.
So when people come to see you, whatever condition they have, whether it's fibromyalgia or thyroid conditions, how do you assess them for LDN? How do you treat them?
Usually, obviously, I take a pretty extensive case history. My first appointments are generally long. They're about 45 minutes to an hour, depending on the complexity of their case. And it also depends on if they've brought me past lab work and information from other doctors. A lot of patients, as you know, a lot of clients, they've seen a lot of doctors and healthcare practitioners, and oftentimes they're told they're fine, even though they don't feel fine, and then sent on their way. And so it's a lot to review. So I usually take their case history into account and their medication history, what's worked, what hasn't. I do blood work on them. If it fits, I do, GI testing on them, looking for things like candida, bacteria. I do hormone testing and adrenal testing if it fits their case. And then when they come back for us to review everything and try to put the pieces together, that's usually when I'll bring up low dose naltrexone, especially autoimmune or cancer history, pain, sensitivity. Especially if they've tried a lot of things over the months and years, and maybe not much has worked, or it's worked a little bit but has not been great. But I bring up LDN often with patients as an option.
And I think it's quite sad, the number of people who have told me that they have a very complex condition and they explain it to their doctor, and the doctor can't find anything wrong and say that it's all in your mind. And I will prescribe you
an antidepressant.
Antidepressants, yeah. And these people are devastated that there is no hope of getting better because nobody believes you're sick. And I think that's very hard to swallow, isn't it? When you're sick and nobody's listening to you and they think you're imagining it.
Right. Especially, a lot of these autoimmune conditions, as you know, the outright symptoms are difficult to see. It's not like somebody got in a car accident and they have, bandages and bruises and cuts and maybe broke a bone, and everyone can say, "Oh my gosh, I'm so sorry you were in a car accident." With autoimmune, especially, or if thyroid things, fibromyalgia, the muscle connective tissue diseases, you can stand there in clothing and look perfectly normal, and you're trying to explain how you feel to your friends or your coworkers or your doctor, and they're like, "Well, you don't look sick."
Yes.
And it's so frustrating. They just feel terrible, and everything on the inside is not right, and nobody takes them seriously because nothing on the outside looks wrong. So how can you be sick? You must be making it up. It must be in your head. You must be depressed.
Exactly.
Probably anxiety.
But you look so well.
No. Yes.
But you look so well.
Or you, right. Or the other one is, and women just push. We push and push and push. And so, friends and family and coworkers say, "We don't seem sick. I mean, you still take your kids to practice and go to school and you still do your job. It's like, yes, we don't have a choice. You still have to live your life. Like you just do it and you feel terrible.
Well, that's it.
So,
Smile and carry on.
I have a lot of patients who say that. My last doctor told me it was all in my head or I was depressed. It's like, oh. That's really frustrating to me.
They must be so relieved to finally find doctors like yourself who are prepared to listen and do the appropriate testing and at least let them know that you understand that it's not all in their mind, that there is something wrong with them, that hopefully you'd be able to, if not fix, improve.
Right. Exactly. And there's so much hope in that. You know, there's so much, especially because people want to live their lives. They want to feel good and have good energy and be able to keep up with their kids and go out with their spouse and love their job and things like that. And it's a real struggle. And they don't know where to go. They don't know where to turn. They don't know, you know, and with the internet, there's almost too much information now sometimes. And so they try something for a day or for a week, or they're not sure if it's real or if it's just things we learn on the internet, which is not always true. And so It's nice and I can say, no, okay, this is what's going on and here are the steps we're going to take. And hopefully it'll, you know, improvement. And if it's not improving, then we'll change course. We'll do something else. Or I'll refer you to somebody who can maybe help better.
And how can people get hold of you?
So I send them to the website, which is www.dutchtest.com. So Dutch, like DUTCH, dutchtest.com. And so on there is all the information about, that's the company, that's where I'm the medical director there. And there are a lot of information, especially about hormones. I mean, hormones is what I do and what we do. And so for those who are struggling, of course, with a lot of these conditions you and I have already talked about, even migraines, a lot of women have hormonal migraines, you know, as they're about to start their period or when they ovulate, they get a migraine. And, of course, LDN can be extremely helpful, but it can also be a tweak in hormones or a tweak in thyroid or their adrenals. And so it can be nice to say, okay, here's what my hormonal picture looks like. We're going to adjust this and, you know, add an LDN and work on the diet and go from there.
Well, it was amazing speaking with you today. We've run out of time. And maybe we can do this again another time.
Yes. Well, thank you. I really appreciate the opportunity. It's been a lot of fun.
Thank you. Find out what's missing in your hormone testing with Dr. Carrie Jones from Precision Analytical, the creators of the Dutch test, a dried urine test for comprehensive hormones. Dutch test results give you all the information from the other methods combined and has easy collection. Visit dutchtest.com for more information. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.